with the marriage?
Oh, no, that's too premature.
Is it? Isn't that before your internship?
No, we set our wedding date.
Okay.
We set our wedding date 9 months later at the end of our internships. My husband had decided to stay at Meharry to do his flex internship. I went to Harlem Hospital, mainly because I had a lot of friends in New York. I had friends in Boston, in Philadelphia, in Washington. I used to spend a lot of time, and in Martha's Vineyard, so my friends were there. So I thought I would enjoy myself, my last year of freedom before I got married.
Okay.
So our wedding date was set for June the 20th of 1946. And I had always wanted to get married in Bond Chapel at the University of Chicago. So that's, the University of Chicago people were wonderful. So that's where I got married. And one of the pictures you will see is us coming out of Bond Chapel. So that was, and it was a wonderful wedding, wonderful experience for me. Then my husband had to give 2 years back to the Army. So I had, I have to tell you about going to to the University of Chicago.
How about the bus at Harlem Hospital?
Oh, yes, you want me to talk about the bus?
Yeah, I do.
When I got to Harlem Hospital, you know, the war had been declared that December before we graduated. No, the war was going on, but that's because of the 999 program. But anyway, when I got to Harlem Hospital, there was a shortage of doctors, there was a shortage of nurses. They gave us 35 minutes of orientation, and then they gave us our assignments. And they said, "You're on the bus." Well, I'm so naive, I didn't know what the bus was. So I finally found a resident who had graduated from Meharry, and I said, "Would you tell me what the bus is?" He said, "That is the ambulance." So this was my baptismal of fire. I went up back to my room and I said, "Oh, what am I going to do?" The first call I had, I transported psychotic patients from Harlem Hospital to Bellevue, up and down, all night long. Then after that, this was about at least a month's rotation, and I had to go up into these tenements on the Lower East Side. There were a lot of Spanish-speaking people. I had Latin and German. All I knew was dolor, pain. So anyway, but after that, I was not afraid of anything, because the two ambulance drivers, they would stay in the ambulance, and I would go up in these tenements by myself. My weapon, you know, you've seen these long flashlight batteries, you put 3 or 4. Yeah, well, I had this flashlight, and I would go up in there. I had anything that I had suicides, I had murders, I had deliveries, so that after that, I had the baptismal of fire. I wasn't afraid to do anything.
Now, it's important to remember, this is pre-paramedics. You're all by yourself. There's nothing else. Your little black bag, and there you go. Right? Yeah.
Then we knew the girl in the front office who made out the schedules. And all the men wanted to they wanted to do OBGYN. Nobody wanted pediatrics. So I went and talked to her, so that my flex internship was a 9 months internship, was 7 months of pediatrics. I only had 3 weeks of chronic female medicine and 3 weeks of OBGYN. And my pediatric residents were wonderful. And they taught me, so that when I went to do my next year at a different institution, I knew how to do all the procedures, and I was great with my hands. And I just felt very comfortable. My senior residents would go out and leave me in charge of the pediatric emergency room by myself, but they just had confidence in me. And I was very good with my hands. They used to say that I could take a 26 needle and put it in a capillary on a preemie's finger. But then I really did not want to, what Harlem Hospital taught me, I never wanted to be away from a teaching institution. So then I said, well, my husband's got to go to the Army. I want to be back in Chicago near my family and so forth. So I said, I think I'd like to go to the University of Chicago. I knew that they had never trained a black physician in any department, in any place, Billings or the Children's Hospital, anything. So I said, well, why not try it? So I went back to my major professor and told him, I really want this job. And I said, I know what the odds are. Will you speak for me? He said, it will be my pleasure. So then I didn't put my picture on the application. No, I got on the plane and I made an appointment and I went out for the interview. I had globus hystericus. But the 4 senior people and the chairman of the department interviewed me. And maybe I appeared calm and so forth, but I was really churning inside because I really wanted this job. And of course, you have to understand my personality. Whenever I wanted anything, I would say there are only 2 answers, yes or no, not maybe. So that this, I wasn't demanding, but I told them how much I really wanted this job. So by the time I got back to Harlem Hospital, because I had not finished my training there because I was about 6 or 7 months into my flex internship. So by the time I got back, they had sent me an airmail special delivery saying they had accepted me. So, I was great. But that isn't the end of it. Then my husband...
It's not the end of it, huh?
Yeah, well, see, no, I signed the contract. But we were married, and my husband thought he was going to the service, and then they told him they had their quota of Negro officers, medical officers, and he didn't have any place to train. So that he knew he wanted to go into surgery, so he applied for Charlie Drew's program at Howard, and also for Matthew Walker's program at Meharry, and he elected to stay at Meharry. He had all of his training in surgery at Meharry and was very exceedingly well trained. But there I had signed the contract, so here we were married, but he was in Nashville and I was in Chicago. But that was a very good year for me in Chicago. Look, I would take all the calls, and a lot of there were veterans there. They were men who were coming back, who had been in the service, and they were in residency programs, and they had families. So I took all the calls on all the holidays so they could spend time with their families. But I would go and see my husband every so often.
Right. Yeah. Now the call about the sick child that you got on the phone, did that
Oh yeah, well I didn't really have any. Oh yes, I wanted to tell them about HH.
Yes.
When the first day I was at the University of Chicago, I didn't have my uniforms from the University of Chicago. I only had the uniforms from Harlem Hospital. It was a caduceus that said HH. So I was in the cafeteria line getting ready to go to the doctor's dining room. So I heard people whispering, "Who is she? Where did she come from?" And they looked on there and said, HH, she's a household helper.
Whoa.
But anyway, in 24 hours, everybody, from the people who cleaned the floors to the head of every department, knew me. I was like in a fishbowl that year. And I was comfortable. We had co-ed living. And there was one other woman who was a resident, and the rest were men. There were about 7 or 8 of us. But we were so close to one another. Like if we got a child who was desperately ill, say a child with meningococcemia, one did the LP, one did the blood culture, one did the history, one did the physical, one started the IVs. And at the University of Chicago, even though we were on call every 4th night, if you had a desperately ill patient, you did not leave the hospital. You stayed in and took care of that patient and counted the drops. You know about counting the drops on the IV.
And then the call?
Oh, one night I was on call, and I got this, you see, the Children's Hospital didn't have any isolation rooms because all the patients were in single rooms or 2 in a room. They had no wards. But if a patient had to be in isolation, they were in a different part of Billings Hospital. So I got this call, and the nurse called me, and she said, "We have a child who's desperately ill over here, a little pickaninny we have just admitted. And I said, fine, I'll be right over. When she saw me turn the corner, I just started giving her orders. I said, get me this plant, get me an IV, get me this, get me that. She said, the child was convulsing. She had whooping cough. She had pneumonia. The child was desperately ill. So I worked, and we got her stabilized and so forth. Then I turned around to this nurse. I said, call the dining room. You know, I missed my dinner. Tell them to send my dinner up. And she was working on her PhD in sociology, an RN. But, you know, maybe I taught her a lesson. I don't know.
Then you go back to Meharry then.
Oh, yeah. At the end of my first year, you know, I was married, and my mother said, listen, you're a married woman, go where your husband is. Yeah, right. So I said, okay. So then I went back to Meharry as my PL2. And when I went back, the chairman of the department was on sabbatical. So the department was just sort of not very well organized. But you know, I weathered through it. And then he came back. He was at the University of Minnesota. And then he came back. When he came back, he made me chief resident. And then the other residents who had been there all the time, they didn't like that at all, you can understand. But the training was good, but it was, the chairman of the department was very hard to get along with. He would stay in his research lab all the time. He would come out about once a month. I was mainly running the department. He would come out and upset everybody. The residents would be in my office crying and so forth. But anyway, and then I just felt that I needed another support person. So my friend Amos Christie, who was chairman of the department at Vanderbilt, he said, Natalia, you can come over in my office and cry anytime you want. I was always crying. And he said, anything that they don't have in the department at Meharry, if you're doing research or anything, it's right here for you. So that was wonderful for him to do that for me. And I did use him as a mentor and backup. Where are we?
Then back to Chicago again last year.
Well, the other thing is that Meharry had a lot of hospitals on affiliation for the surgical residency program. So we hadn't been together but about 6 months, and they farmed my husband out to one of these hospitals. And then when he was only supposed to stay 6 months, when it came time for a replacement, they had no replacement for him. So he stayed another 6 months, and we had another long distance marriage. The first 7.5 years of my marriage were long distance. Then my father became very ill.